Thank you for the introduction, Nicole, and thank you all for attending today's webinar on Your Guide to Success, the UCA Accreditation and Re-Accreditation Process. As Nicole stated, my name is TDunn, and I'm UCA's Director of Standards and Quality. I've been working for UCA over the past 3 years, starting as the certification specialist, and have grown into the role I have today. This presentation will cover what accreditation means for an urgent care organization, explain how to navigate the standards manual, what to expect during the survey process, how to apply, the fees involved, and options to help maintain accreditation and resources that UCA provides. As Nicole mentioned, don't forget to save the attachment provided, which is a deep dive into the accreditation and re-accreditation process and is a helpful handout for your staff and colleagues to review. Here are the learning objectives, which I previously summarized, so I'll leave it up on the screen just for a couple seconds if anyone wants to review them. UCA accreditation demonstrates the commitment to provide the scope of care consistent with an urgent care center that meets the criteria of a UCA certified center, including X-ray and laboratory services, as well as a quality and safety commitment to your patients and employees. It also represents the only endeavor in the industry that will provide the applicant dual accreditation and certification. So what kind of commitment are you making by becoming accredited? You're making a financial and human resources commitment, a willingness to conduct a comprehensive organizational assessment that examines your center's capacity in each category listed in the standards manual. You are also ensuring access and a scope of services to your community representative of a UCA certified urgent care center. Now that you understand the type of commitment involved, we'll move on to some important terms. What is a standard? Let's backtrack and talk about where you would find the accreditation standards and what they are for. So when you apply for accreditation, you are applying for certification and accreditation all in one. This means that your organization needs to comply with our certification criteria and accreditation standards. The detailed manual will provided to your organization free of charge once you have committed personally and financially to move forward with the process. We always recommend purchasing the standards to start preparing ahead of applying. So what is a standard? UCA's definition is that a standard is a practice goal for a field or industry that is widely recognized or employed as a model of excellence. UCA standards include governance, human resources, patient care processes, quality improvement, physical environment, health record management, patient privacy rights and responsibilities, and UCA certification criteria. Each of these sections has their own set of standards that need to be implemented by the organization applying for accreditation. This manual is going to make sure your organization is ready for your on-site survey. What is the difference between a standard, expectation, and a success demonstrator? So in the standards manual, there will be 3 columns that are labeled with each of these titles, and so it's important to know the difference. A standard is a requirement that must be demonstrated in order to prove compliance. For example, it will state something like patient care processes, patient identifiers. The expectation is also a requirement that must be demonstrated in order to prove compliance with the standard. Expectations provide greater detail of the standard. For example, continuing with patient identifiers as the standard, the expectation would be that there is a written policy defining no less than 2 patient identifiers. The success demonstrator is a suggestion, which is the key word here, of how to demonstrate evidence of an accomplishment of an aim or purpose. For example, an accomplishment of a standard and its expectations. To complete my example, the success demonstrator of the standard patient identifiers would be surveyor observation and staff and providers are able to articulate the identifiers. This is just a suggestion, which is important to differentiate between what each of these definitions mean to UCA. Now that everyone should have a full understanding of the differences between a standard, expectation, and success demonstrator, I wanted to express some helpful tasks while preparing. Please confirm that your organization is working with the latest edition of the Accreditation and Standards Manual. The most current version is 2019, and the 2020 Standards Manual will be released to attendees on the Accreditation workshop during August 7th and 8th. Everyone else will receive them shortly after that. While preparing, you want to engage and train your staff. Preparation for your on-site survey should not be done with just administrative staff and managers. It should be a team effort that involves everyone. Educate your staff and providers about how dual UCA accreditation and certifications will support their commitment to quality practice, patient access, and your center's dedication to excellence. Conduct training for staff on how to use and apply the standards to assess current practice. Training should include the structure of the standards and related content within each section. Assign a time frame for each team to conduct a self-assessment of their assigned sections. The self-assessment should include reviewing all standards and assigning a preliminary rating for each. The self-assessment should also include that the required documentation is available and up to date, and that the organization feels prepared to engage in the on-site survey activities that will occur. Use tools provided by UCA to help in the self-assessment. UCA has developed several, including readiness checklists. The tools should be used in conjunction with the standards and should not replace reviewing the details of each standard and assessing current operations and processes with regards to the standards. Develop improvement action plans for standards identified as areas of concern. Formalize action plans, including the assignment of a responsible individual with timeframes and clear expectations of the work to be done to help ensure your accreditation timeline is met. And lastly, gather all documentation to demonstrate compliance with the standards and have them available on-site for the surveyor. Consider conducting an internal mock survey visit to assess organization readiness for accreditation and re-accreditation. You may consider conducting one at the beginning of this process, along with another mock review as you near your site visit. Mock site visits can include a facilities review, medical record review, and extensive interviews with staff to ensure that there is implementation and full understanding of the standards. Used at the beginning of the process, a mock visit can help assess where your most significant gaps are and define where you will need to invest the most amount of resources and staff time. Sticking to your timeline will keep your organization on task and ready for your site visit. Keep your staff focused by sending weekly and/or monthly updates and reviews on where your organization is at in the preparation process. Make sure all staff are aware of key deadlines, such as the date of your survey, date of your mock survey, etc. And don't feel pressured by your survey date. We will notify you of your survey date as soon as we have confirmed it with the surveyors. This will allow you to plan your deadlines accordingly. How do I apply? We have developed a new online application process for certification and accreditation. All required documentation and forms will be submitted through the online portal and reviewed by UCA staff. If you have consistently been the key contact for accreditation and certification, we have already designated you as the main contact in Certification Bank. We sent out a welcome email on March 27th of this year, which provided the organization key contact with login instructions. First step is to go to the website, which is uca.certificationbank.com, and make sure you bookmark this site as it is different from our ucaoa.org page. Your username is your email address, and if you have not logged in previously, you will need to create a password. Here is what the welcome email looked like if you would like to search your inbox after this webinar. This is what the Certification Bank homepage looks like. If you did not receive the welcome email and are unsure if you are the key contact, please reach out to UCA staff and we would be happy to help. If you have been sent the welcome email or have been provided access by contacting a UCA employee, click on Forgot Password as shown on the screen. The Forgot Password pop-up will allow you to input your username, which is your email address. Click on Submit and you will be sent instructions to your email on how to reset the password. Once you've reset your password, you can go back to the Certification Bank homepage and log in with your email and new password. Once you've successfully logged in, you'll be brought to your organization's profile, which will list your membership details, accreditation status, and certification status. If the membership information does not look correct, you can click on the highlighted link and email our membership department directly to assist you. Membership details will be important in knowing the fees that your organization will be invoiced for accreditation or certification. In your organization's profile, you will scroll down to accreditation status and find your organization's name listed under company and an action to apply, which you will then click on to start the application process. Please note that if you scroll farther down the organization's profile page, you will see the certification status and all known centers listed. If you have previously certified any of your locations, that information will be listed here, even if certification status has expired. If you are planning on applying for accreditation, there is no need to pay attention to this section since certification is included in accreditation. To initiate the application, you will be brought to this page acknowledging that you understand the process involved. The accreditation application homepage has 4 parts to it. You will notice there is an action column to the right of the page which lists each item that you can begin. Once you click on Begin, it will take you to the requirement and you could submit the materials if applicable. The application fee initiation is to notify UCA staff that you are aware that the application will not be fully processed until payment has been submitted, and it will also prompt staff to send you an invoice which can be paid through the ucaoa.org website or over the phone with UCA staff or by sending in a check. After payment has been initiated in the application, UCA staff will send your organization an invoice for accreditation, which is determined by the number of centers you have and your organization's UCA membership status. If your organization has more than 25 centers, please call the number listed and we can discuss pricing, or you can email or call me directly. Payment must be remitted in order to process the application fully and get started on scheduling your on-site survey date. If you have certified all of your centers and this is your initial accreditation application, you can receive 10% off pricing by notifying UCA staff. If you are applying for early accreditation, there is an additional surcharge of $200 for members and $400 for non-members per location, which is added to the above pricing. After you have submitted payment, you will receive a complimentary copy of the latest version of the UCA Accreditation Standards Manual. If you have already purchased the Standards Manual prior to applying, please notify UCA staff and we will deduct the price you paid, member or non-member, from your accreditation application pricing. After your organization has submitted payment, you'll be sent a business associate agreement and survey scheduling form. We typically recommend every organization, no matter their size, to have the Accreditation Standards Manual for at least 90 days to fully be prepared and have a successful survey. We base the time frame we spend on how long you have had the standards for review. If you have not purchased them before applying, we provide a time frame that reflects the 90 days we recommend because we want your organization to be successful. We understand that this is your time and your money, and we want to ensure that you do not waste either by scheduling your survey too soon. It is important to notice that you receive 5 blackout dates. We are asking for your organization to provide 5 days within the time frame we provide that you would not like us to schedule the survey. Please keep in mind that we never schedule surveys on holidays, and we only conduct surveys on weekdays unless the organization has requested otherwise. We pride ourselves on being very accommodating, meaning we understand that schedules can be a little hectic, and we want to make sure that your organization is ready for us when we arrive. That being said, please make sure you notify UCA staff if you feel the time frame provided is too soon or too far away, or you are aware of multiple days that senior leadership will not be available. Surveyor availability is a key factor in when your survey will be scheduled as well. After the application is completed, your organization's homepage will display that your application is pending UCA review, which means that the staff and committee are reviewing your submission and will be contacting you with next steps. In the certification status section, you will notice that each of the centers you include in your accreditation application, which should be all of them, will be listed as included in AUC application. And you will not be able to apply for certification, which makes sense since certification is included in accreditation. In this example, you can see one of the centers previously applied for certification, and it was earned on April 30th, 2016, and expires on April 30th, 2019. If the center was still certified, we would notify the surveyor ahead of time, which means less work for the surveyor while on site. This does not guarantee that they will not review certification requirements for that location, but it could save some time. Here are some of UCA's store products that are recommended for purchase while preparing for accreditation. As you can see, we have member and non-member pricing listed, so you not only save money on your accreditation application fees if you become a member, but you also save on our store products, among other things. Remember that the standards manual is highly recommended to be purchased prior to applying, since UCA will deduct the price you paid off your accreditation application. But it is not necessary since you receive it for free when you submit payment. Additional fees. The only additional fees that your organization will be responsible for post-survey is the surveyor travel expenses and any additional travel and added per diem if more survey time is required. We rarely have additional travel time, but a scenario where the surveyor has requested additional time is when a multi-center organization has not even acknowledged the standards manual, and the surveyor wants to compare the first location to another center to see if the cited standards are consistent across the board. Can I apply before I open my center? The answer is yes. Early accreditation is the option you are looking for. You can apply up to 6 months prior to opening your center. During the online application process, you will be asked if you want to apply for early accreditation when reviewing the clinic rosters. You would check yes, and UCA staff will send you an invoice with the early accreditation surcharge included. Here is an example of the surcharge. For members, it is $200, and non-members, it is $400. Taylor's Urgent Care, which is a great name, is a member organization that will be opening 3 centers and is applying for early accreditation. This would mean they would fall into the 3 to 4 center pricing tier, which is the member price of $3,850, plus $200 per all 3 centers, which would equal $4,450. There are some important differences to note when applying for early accreditation. After you submit your application and pay the associated fees, you will need to complete a notarized attestation statement, which will be emailed to you once you have paid for the application, along with documentation for the tax ID number for your center, documentation regarding the physical address for your center, such as a copy of a lease or letter from your landlord. You will also need to submit a floor plan for your urgent care center as well. After the Step 1 documents are submitted and approved, your organization will receive an early accreditation status letter that you can present to your payers stating that you are in process of achieving accreditation through UCA and that early accreditation status will expire on blank date, 6 months out. Keep in mind, you must open your center within 6 months of applying for accreditation. We understand that there can be delays due to construction and business plans, but we encourage your organization to open within 6 months of applying. The best advice I can give is to keep UCA in the loop. The longer you wait to notify us of your delayed opening date, the harder it is to provide your organization with an extension. Once you open your doors, you will have 60 days to schedule your on-site survey. For example, if I applied today for early accreditation, I would have 6 months from receiving my early accreditation status letter to open my center. From this point, I have decided to open my center on July 4th because fireworks are dangerous. And that means I have 60 days from opening to get my survey scheduled. My survey may not be scheduled for 3 months due to surveyor availability, but it is on the books, and that is what is most important at this point in the process, other than preparing. There are 3 stages in the on-site survey process: the pre-conference, followed by the site walkthrough, and a post-conference. When a surveyor visits your organization, they assess the way you have implemented and/or interpreted the UCA standards. The surveyor will evaluate the center's scope of care to ensure it meets the criteria established. And an organization's initial survey does not require a demonstration of history of standards. This is only required of organizations that are renewing their accreditation. The first part of the on-site survey visit is what we call the pre-conference or kickoff of the visit. The surveyor will introduce his or herself to the CEO, executive director, members of the governing body if appropriate, executive and management staff, and other key staff members who will be involved in the site visit. The surveyor will also review what can be expected during the survey. During this portion of the survey, staff will be allowed to ask the surveyor which other locations they plan on visiting, if applicable. The surveyor can decide to tell you or withhold the information, but they typically are happy to tell you. Following the pre-conference, the surveyor will start reviewing governance, credentialing, privileging, HR, and the QI plan, while there are key staff members present. If you only have this information available electronically, that is perfectly acceptable. Just make sure someone is able to help the surveyor navigate the information. Keep in mind that each of the surveyors has their own style and may decide to approach the QI plan at the end of the survey. During the interviews and observations portion of the on-site visit, the surveyor will tour the organization's facilities to observe the safety, quality, and maintenance of the center. The surveyor will engage staff and patients during the process, and the discussions with staff and patients will determine satisfaction of services, if written policies and procedures are implemented or understood, and to help the surveyor get a feel for the overall culture of the organization. During the post-conference, the surveyor will provide the organization with initial feedback and ensure that all administration, board members, executive, management, and key staff members understand what to expect next. This will allow the organization to ask questions and bring closure to the on-site survey process. Who are the surveyors and what is their role? UCA surveyors consist of the following group of professionals: registered nurses familiar with healthcare accreditation processes, physician assistants familiar with healthcare accreditation processes, practice administrators in the urgent care field, healthcare professionals in the urgent care field, recently retired senior staff members from urgent care organizations who continue to maintain an active role in the field. Surveyors have experience with the accreditation and survey process and have demonstrated a true commitment to the purpose and goals of UCA accreditation. How should we prepare for the on-site visit? By now, all of you know the answer to this, which is to prepare with the accreditation standards. However, here is a list of recommendations to ensure your survey is flawless. Utilize key UCA resources such as the Policy and Procedure Manual, Compliance Manual, HIPAA Manual, and all other manuals UCA offers. Prepare your staff in advance, review your certification checklist, make arrangements for the pre- and post-conference, and send invitations to key staff to attend these meetings with the surveyor. Identify a room for the surveyor to use while on-site that offers privacy and minimal disruption. If evidence is in electronic format, arrange to have a computer available with access to online manuals and other important documents. Ensure your human resources records, credentialing and privileging records, and QI documentation are available on-site prior to the surveyor's arrival. Also be sure to designate a staff person to facilitate all interactions with the surveyor who is knowledgeable about the location of records and other important documents. Identify key staff to escort the surveyor to all scheduled location visits. Prepare staff at all organization locations of the surveyor's visit, not just the primary corporate location. And develop a plan to reward staff for their participation at the conclusion of the site visit and share the feedback from the post-conference. What happens after our site visit? Take a moment to celebrate your organization's achievements and recognize that the completion of the site visit is a significant milestone in the process. Make sure your staff knows your appreciation for how hard they have worked to get to this point in this process, and it is a team effort all the way through. Evaluate how the site visit went and ask yourself, in what areas of the standards did we do well? Where did the surveyor identify areas for improvement? The UCA surveyor will send completed documentation with comments to the UCA Accreditation Committee. The UCA committee then begins preparing your report. This report identifies only those standards that require a response and/or improvement action steps in order for the organization to achieve accreditation. After every survey, all organizations want to know when they will receive their survey results, and the answer is that you'll receive them within 45 business days from the site visit. The organization will receive a cover letter and instructions on how to prepare the response in electronic format. Once you receive your results, which could be that you had a perfect survey and have no action items to follow up with, you will have 60 days to provide your response if at all needed. I would keep in mind that if you were to have follow-up action items to turn in, to not use your full 60 days to do this. The reason is, if you were to turn in an action item that was not completed to the satisfaction of the committee, they would send you a second follow-up response, and you will have the remainder of your 60 days to complete this task. For example, if you received your initial survey response and had 5 action items to complete, and you used 55 of the 60 days to turn them in, this means that if you had to fix any of the documents turned in, you would have 5 days to do so, and you don't want to be stuck in that situation. Can my organization cancel or reschedule a survey date once it has been confirmed? Canceling a confirmed survey date will result in forfeiture of the entire application fee. The applicant will be responsible for any non-refundable expenses, including travel arrangements already made. Rescheduling a survey date after it has been confirmed will result in a rescheduling fee. The applicant will be responsible for any non-refundable expenses and added costs due to travel change fees. We want to ensure your organization is ready for the on-site survey, which is why we schedule the survey at least 3 months out. We work with your organization throughout the preparation phase and are available via phone or email to answer your questions regarding the standards and on-site survey process. The best way to feel prepared, regardless of how far along you are in the process of applying, is by attending one of the 2 accreditation workshops that are offered this year. I will provide further information on this later in the presentation, so make sure you pay attention. The levels of accreditation are accreditation and reaccreditation, pending, provisional, right to resurvey, and denial. I know this slide looks like it does not have a lot of information, but the truth is I couldn't include it all in one slide, so get ready to take some notes. The accreditation and reaccreditation means that the accreditation committee awards accreditation or reaccreditation to an organization for a period of 3 years. When the applying organization meets all the requirements of UCA standards and expectations following a site visit, and there is no cause for concern about implementation or continuing performance with UCA standards. This also means that the organization meets the criteria established to be recognized as a certified urgent care center. Pending. When the accreditation committee has questions about an organization's implementation of continuing performance with the standard that may require additional documentation for approval, they have the discretion to place the organization on pending status and to request this documentation. Full accreditation is not granted until the organization submits this documentation and the committee finds it meets the standard. Provisional. The accreditation committee grants accreditation to an organization with the stipulation that the organization must submit additional documentation of completed compliance within a designated time frame. If your organization does not submit the requested documentation, its accreditation designation is revoked. Right to resurvey. The committee reserves the right to resurvey the organization depending on the initial survey findings. It is the responsibility of the applying organization to submit a new application and fees for this resurvey. And denial. The accreditation committee reserves the right to deny an organization accreditation status if a surveyor determines during a site visit that an organization has failed to meet the minimum standards and there is no opportunity for corrective action. A surveyor determines during a site visit that the organization blatantly compromised patient quality or safety. An organization fails to respond to the committee's request for additional documentation within the appropriate time frame. And an organization fails to pay applicable accreditation or post-survey travel fees. And of course, an organization has the right to appeal a denial decision that has been made by the committee. Next steps after achieving UCA accreditation status is to receive an approval email notifying all key contacts of your newly earned accreditation status. You'll receive an electronic copy of your approval letter, and UCA databases will be updated immediately. The email will also include promotional tools, sample press releases, and if you would like, we can send you an electronic certificate in PDF form. The physical recognition packet mailed to you will include your approval letter, certificates, and window clings reflecting your accreditation and certification achievements. And UCA will promote your successful dual accreditation certification distinction on our website and other social media outlets. The attestation forms are important to understand for an organization that has been accredited, because this is how you will add a center, add any acquired or merged centers, and change the name or venue of your center in our system and on your certificate. The early accreditation attestation form will be provided to you via email once you have submitted your application for early accreditation at no charge. If you have been accredited and have opened a brand new center, you will request and add a center attestation form. For members, this form will cost $100 and non-members $150. Once the form is completed and returned to UCA staff with payment, you will receive certificates for the locations added, and our website will be updated to reflect the additions. On the attestation form, you will mark down the date that your center will meet the standards for accreditation and certification. Many people are confused by this and want to mark down the date they are turning in their form. The center can only be added by attestation if the center was not open during the initial survey and could not be visited by the surveyor. The date listed will need to be a date past the day of opening, and it will indicate that a surveyor can come on site after the date listed and will find that the center is in compliance with our standards. The date indicated will also be the date that is listed as the effective date on our website and on our certificates provided. Change of venue or change of name are simple attestation forms that need to be completed so we can update our records at no charge. Acquired or merged centers must submit a letter to UCA within 30 days of the transaction. Notify UCA of your intent to maintain, relinquish, or alter prior accreditation status. UCA shall provide a response addressing next steps within 30 to 45 days. Changes to current accreditation status can occur based on each scenario. Last year, the Accreditation Department rolled out the annual compliance review program. It is completely optional in most cases, but completely worth it in order to make sure you are ready for your renewal after your accreditation status has expired. Over the past year, multiple organizations have engaged in an annual compliance review and walked away feeling prepared and confident for their accreditation renewal on-site survey. The program will provide guidance for your organization, along with the opportunity to discuss corrective action plans in the event you or your surveyor determines compliance is insufficient to meet a specific standard or expectation. Accredited organizations should continually monitor themselves and review their processes for meeting standard requirements throughout the accreditation period. Continuous involvement by administration, management, staff, medical providers assures engagement in the process and successful reaccreditation by the organization. Should there be a change in status, ownership, or scope, your organization must notify UCA within 30 days of the change. The goal of this program is to help organizations stay on track, maintaining documentation, demonstrating compliance with the accreditation standards and expectations. The program offers a minimum of a 1-hour telephone call with an experienced UCA surveyor and the organization's leadership designee. The program cost is $150 an hour and does not guarantee a successful resurvey. It is offered on an annual basis during the 3-year period between an organization's site survey and resurvey. It will also provide the opportunity for organizations to ask questions related to any new or revised standards. It also allows the organization to establish the agenda to determine when they would like to review. For more information about the annual compliance review, please contact the UCA Accreditation Department by email at accreditation@ucaoa.org. The reaccreditation process starts with UCA reaching out to the organization 8 months prior to expiration. The reason for this is to completely avoid expiration of accreditation status, and we will call this the worst case scenario. The renewal process should not take a full 8 months, but we know that organizations are busy and may have a hard time scheduling the resurvey. 7 months out, you will receive the latest version of the accreditation standards complimentary so that your organization can make sure they are prepared, and you will need to show a history of compliance. Keep in mind that you should already have the standards since we always send out the latest version to all organizations as they are released. 6 months out, your survey will be scheduled. Based on how quick the organization is at responding, this may happen sooner. 5 to 4 months out, your survey will be completed, and 3 to 1 month out, the decision by the accreditation committee will be made to determine if your organization has successfully become reaccredited or not. You will receive a new recognition packet, and your organization's success will be announced on our website and on social media. I briefly mentioned the accreditation workshop, which each of you will benefit from attending. The first workshop will be at the UCA headquarters in Warrenville, Illinois on August 7th and 8th. The second workshop will be after the NARUCA conference in Springfield, Massachusetts on November 5th and 6th. Register today at ucaoa.org/workshop, where all of the sessions, hotel details, and agenda are listed. And since you've taken the time to listen to my webinar, if you email or call me directly, I would be happy to offer you a discount if you would want to register for one of the workshops. And you can meet me in person, which I know you all want to do. The workshop will include topics such as preparing for your initial survey, credentialing, privileging, and best practices, ancillary compliance, lab protocols and radiology, HR record management, development of a self-audit tool, quality improvement plan and antibiotic stewardship, and my favorite, a survey snapshot, a glimpse into an on-site survey where the event space will be converted into a mock urgent care to walk attendees through the survey process. This will also include an in-depth look at the process of the pre-conference phase of the survey, where the surveyor will address typical challenges organizations face during review of the medical record audit, HR records, governance, credentialing, and QI plan. Thank you so much for attending this webinar, and I hope it addressed your questions or concerns. On this slide, you will see my department's contact information. Please feel free to reach out to any of us if you would like to further discuss any questions you may have regarding accreditation or certification process.
Thank you, Taylor. Before Taylor,
I'm just passing it over to you.
Okay, thank you. I'm sorry. Okay, thank you, Taylor. Before Taylor answers your questions, I'd like to let you know that if you enjoyed today's webinar and are interested in the 2019 UCA Accreditation webinar series, you may purchase the bundle on our website and you'll get a recording of the previous 3 webinars. So our first question, so if we are certified urgent care, why should we pursue accreditation? What is the benefit, and can we continue to just stay a certified urgent care?
So you can always decide to stay just a certified urgent care. There's a lot of benefits to accreditation, but the largest one is that it may help with your payer reimbursement, and there is a trend across the U.S. Where it's being required by some payers. So you're just going to stay ahead of the game there. It's great for your competitors to see that you're accredited, and accreditation covers quality, safety, and scope of services, whereas certification is just covering scope of services. It depends on where you're located, and I'd be happy to speak with you directly if you'd like to email me or give me a call, but it really depends on the individual organization on why you've chosen to go through accreditation.
Okay, thank you. And then there was a question, if I get the standards manual for free when I apply, why should I purchase it?
Great question. So the reason we want you to purchase the standards manual before applying is because this is a financial commitment, and a lot of times organizations may not fully understand what's involved in accreditation. And so they pay for the application and later find out what's involved, and maybe it's just not the right time for them, or they wanted to apply later and get accredited later on, but we've already started the process. So really what the standards manual does is it lets you look through the standards, see what's expected of you and your organization, and then make that decision to move forward with applying. And of course, get reimbursed for that amount.
Okay, thank you. The next question, which payers require UCA accreditation?
So we currently have a list of certain payers in certain states. Off the top of my head, I don't know of them because the list just keeps updating. But if you reach out to me, I'd be happy to share that information.
Thank you. Looks like we don't have any more questions, but again, thank you, Taylor, and thank all of you for attending. Our next webinar in the 2019 UCA Accreditation Series is Competency Assessment for Staff, and that will take place on Thursday, June 20th at 1 p.m. Central. Attendees may earn live CUCMP credit. UCA has developed the Certified Urgent Care Management Professional, or CUCMP, curriculum to serve as the next step in development and advancement for the urgent care urgent care manager. The CUCMP program offers not only higher level courses, but a designation once completed. Visit the website for more information or send an email to cucmp@ucaoa.org with any questions. The next CUCMP webinar is Project Management for Success, and it takes place on Thursday, June 27th at 1 p.m. Central. Attendees may earn live CUCMP credit. Please visit the UCA website for more information on the 2019 UCA Accreditation Webinar Series, Clinical Webinar Series, and CUCMP webinars, as well as the calendar for updates on all upcoming webinars. This concludes today's webinar.